Management of eczema in children. For the latest updates in dermatology, refer to the Pediatric Board Study Guide 3rd edition. General management of eczema. The first step in the management of eczema is the correct diagnosis. Pruritus and itchiness is the most important manifestation of eczema. Itchiness. And the itchiness will cause loss of the outer protective layer cornea stratum. And when the patient doesn't have cornea stratum anymore, the skin will be dry, and the dryness will cause more itchiness, and the itchiness will cause more dryness. And because of frequent itchiness, the skin will be injured, and you will see the skin here is abraded. So the abrasion of the skin is well known as excoriation, sometimes even bleeding. And the frequent itchiness also will cause thickening of the skin or lichenification. Also, eczema associated with hypo or hyperpigmentation depending on the original color of skin. Eczema is a chronic condition, and also relapse is very common. If we understand the pathophysiology of eczema, it's very easy to understand the management. First symptom is itchiness, so we have to manage the itchiness. Part of the management of itchiness is to give oral antihistamine, and the best is first generation, such as hydroxyzine, diphenhydramine, because it has sedative effect. It's anti-itch and also it has sedative effect. This is the best to manage the itchiness associated with eczema. Then the skin is dry. We have to manage the dryness because the dryness will cause more itchiness and will make the eczema worse. So we have to manage the dryness of the skin by providing a thin layer on the top of the dry skin of ointment. The best is ointment, not cream, or heavy cream, not lotion. So this will help the skin to stay moist because the patient already lost the stratum corneum, so the skin will be dehydrated very quickly. And you have to apply very frequent, 5 or 6 times a day, to keep the skin always moist and greasy. Then we have to manage the inflammation. How to manage the inflammation? By giving topical corticosteroids. So topical corticosteroids with different strength depending on the severity of the eczema. So you can use from low potency to high potency depending on the severity. For how long? Until clear. So you can use it for 5 days, for 7 days, for 10 days, for 2 weeks. As long as there is inflammation, you have to continue to use it. Once the inflammation is clear, you may use it once or twice a week to prevent the flare of eczema. Let's summarize what we have discussed in the previous slide. Management of eczema emollients. Ointments-based emollients is a cornerstone of therapy, very important. Corticosteroids, very important for inflammation. Ointments-based is better than cream. And you can use it twice daily until clear. Then you can use it as needed or twice a week to prevent the flare-up of eczema. Keratolytic agents, you can use it in cases of keratosis pilaris or ichthyosis vulgaris. You can use lactic acid or citric acid. Antihistamines for anti-itch, you can use cetirizine or loratadine, second generation during the day because it's not sedative, but at night it's very important to use hydroxyzine, first generation, or antihistamine in general, first generation like diphenhydramine because of the sedative effect. And this is more effective than cetirizine or loratadine. Antibiotics if secondary bacterial infection, allergen elimination. Also very important to recommend to the patient to use non-cleanser soap. Again, management of eczema daily, frequent bathing to keep the skin well hydrated. Apply immediately after the bath moisturizer. This will keep the skin more hydrated and will keep the moist under the emollients. Trigger avoidance, like avoid using high potency soap, like strong soap with fragrance. Use non-cleanser soap and shampoo. Topical medications, like we have mentioned, like topical corticosteroids. Management of pruritus, especially with first generation antihistamine. Management of super infection, like virus or bacteria. Systemic therapy in severe cases and phototherapy. Be familiar with different strength of topical corticosteroid. We have low potency, like hydrocortisone. It comes in 0.5, 1%, 2.5%. And low potency is recommended to use for infants with seborrheic dermatitis, with infantile eczema. You can use it in the face, on the trunk, on the extremities. It's very effective. You can use the ointment. It lasts longer. Also for older children, you can use it in the face. It's not recommended to use for eczema on the face medium or high potency corticosteroids. Medium potency steroid like triamcinolone 0.1, 0.5%. It comes in ointment and cream. Betamethasone valerate 0.1%. So you can use medium potency for eczema in areas other than the face. High potency for severe eczema like betamethasone dipropionate 0.05 or clobetasol propionate 0.05 or fluocinamide 0.05 for severe eczema. Bathing is part of management of eczema. The frequency up to daily. The benefit will hydrate the skin, remove crust, allergens, and irritants. Is recommended to use non-soap cleansers and hypoallergic detergents for washing the cloth. Neutral to low pH soap with pH 4.5 to 7. Use hypoallergic and fragrance-free soap and products. Short bathing, soak and smear mean that after bathing, apply emollients on the skin immediately. You may also use bleach bath because will decrease the staph colonization and decrease the frequency and severity of eczema. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.